clearly I don't. It's been an interesting 4 years. Prior to Bob Brink deciding to retire and going into the McAuliffe administration, he was the only person in the House of Delegates that represented any precincts in Fairfax County, even though he lived in Arlington, on the House Appropriations Committee, either side of the aisle. And when he left, I was able to convince the Speaker to appoint me to his seat, and then I was the only Fairfax County person in the House. Now we have Paul Krizak has joined me on the committee, and that's I attributed my getting on appropriations and working on these issues a lot to Bob Brink retiring and Donald Trump winning the election, because these are outstanding freshmen we have here today. You heard from one of them already. You're going to hear from two more here. Just outstanding people. But there's no question that the feeling in our country now, and the resistance in our country to what's happening in Washington, propelled a lot of victories on our side, and we're going to have a real challenge next year in 19 to make sure all these great 15 freshmen who won Republican seats can come back. We have 16 freshmen altogether, so we have a lot of people who have not been around too long, and so I was the next down in line in seniority on the Appropriations Committee to as you're going down, that voted for Medicaid expansion. Obviously, all 10 of us on the committee did. So that is the primary reason that I was appointed to the conference committee, and so now I get to see Janet Howell and Dick Sassel even more, because they are the two that have been on the conference committee on the budget for a long time now. And of the 6 of us from the House, the Senate has 7, and plus they have George sitting in for all the detailed work. And we only need 6, and we can take them on just fine. And because their budget is such a nonsensical piece of junk. Actually, they expanded Medicaid in many ways, but on a 50-50 basis instead of taking the 90-10 money. Well, right now, actually, the 94% money, it hasn't gone down to 90 yet, and they didn't pay for it. They expanded it, created an instant waiting list for services for the substance abuse, the opioid problem, and for mental health, but they didn't put any money in their budget to pay for it. So that's interesting. So we spent a lot of time in conference dealing with the language issues. The Senate had a ton of language issues on healthcare, health and human services issues, and we worked our way through a lot of that. But when we got to how much money to spend, we weren't able to do that because we don't know the top line number yet. So right now, the House this week on Tuesday sent the bill over to the Senate. Senate Finance Committee has not scheduled a meeting yet to take the bill up. So we do not have a bill in conference yet, but I do think that'll happen shortly. I was involved with most of what I did for the first month. The first month is when you do the most work because we only have a month before crossover. And I put in a straight ahead Medicaid expansion bill that had no bells and whistles on it. And I also put in a budget amendment that was language drafted by the Virginia Poverty Law Center. What they were trying to do is convince the majority to pass Medicaid expansion without seeking a 1115 waiver. That didn't work, but some of the language that they put in there is pretty conservative sounding about the things you can do to encourage responsibility, individual responsibility, without seeking a waiver. So the waivers are test programs that the HHS and CMS has to approve in DC to prove that you can save money in Medicaid and make it work better. And several states have done it. Some states that expanded Medicaid right at the beginning have come back over the years with 1115 applications. So we're looking at it's such a big deal that the Republicans decided to do this. And the election of these folks that we mentioned is the primary reason. On election day, the exit polls showed that health care was the #1 issue concerning Virginians, And the Speaker of the House and the chairman of our Appropriations Committee decided we were going to go this way. They could not convince, they have 51 members in the Republican caucus. They could, when we finally got to the end, they could only produce 19 votes for the Medicaid expansion. But one of the reasons they could get 19 was that we developed a program that we're going to have to seek a waiver for called TOP. TOP stands for Training, Education, Employment Opportunities. This is similar to TANF VIU program. By the way, we have historically low numbers of TANF recipients in Virginia right now. There are only 15,000 that are on TANF VIU now in the whole state, 15,000 people. And we spend a lot of money on that. I'm interested, and I do not know exactly how to characterize the success of the efforts we're making right now in TANF VIU. But requiring people to work if they're getting public benefits is not a new concept in Virginia. Even in the SNAP program, I believe there are some requirements that and that's a totally funded federal program, except we administer it. So there was, and I'll cut this short because I could go on and on, but there was, on the Senate side, there were people, and some on the House side too, that didn't think our TOP program was strong enough. And so this past week, when we passed the budget again, we tweaked it a little bit to make it look a little tougher with some language that DMAS could have implemented themselves, because presumably if we pass this TOP program, DMAS has to create the rules for it. There will be a lot of rulemaking to go along with this in the future. But we made it a little bit, quote, tougher, unquote, so that the criticism that this was a work suggestion would be countered a little bit. So that's where we are, and I think it might have helped. We also, importantly, put in a provision to seek another kind of waiver that's not Medicaid related, only that it could save Medicaid money because everything in healthcare is related to everything else. And that's called a 1332 waiver. States are using that now. 4 states have gotten it approved to create a reinsurance fund. Senator Kaine has a bipartisan bill in the Senate to create a reinsurance fund. And the idea there is to take the most expensive healthcare cases out of the pool to reduce, so that the insurance companies can get a better idea of what they are insuring in our state exchanges. So if you read the paper, you know how expensive insurance is if you're not on a group plan. If you're in the individual market, it's really out of control, and we need to do something about it. So this is an attempt to do that, and that was a direct attempt to get one of the senators to come over to support Medicaid. So we're in the midst of working out the details. I believe Dick described the big picture correctly. I hope he's right about getting Medicaid expansion, but it's all in the details now. But I do think we have the numbers, and it's politics at its biggest level. The Senate Majority Leader wants to retain his title as Senate Majority Leader, and that's probably the biggest issue to getting the votes out of conference. In the conference committee, the majority of the senators and the majority of the House members both have to agree to something, not the entire committee. And so we are just on the edge of one vote on the conference committee to getting the Senate to agree to put it in the conference committee. So,
is there anything we can do to help you get that vote?
Well, if you know people that live in Virginia Beach and in far southwest Virginia, Frank Wagner.
I have a daughter and a granddaughter there.
Okay. Well, I think that the target senators are being well hit up, but
okay.
I could tell you later who the 5 or 6 are that people are talking to every day. So I could talk more, but
yeah,
I'll just leave
you
it
could
at
send
that.
me an email to that effect.
Okay.
I'd appreciate. I'd like to ask you one more, if you could answer briefly on behalf of Kathleen Murphy. We put in a TANF scholarship pilot project, and she worked beautifully across the aisle with Senator Stanley, and it got all the way to appropriations. It got on the docket, but you show up and it's just stays on the docket. They don't address it, or they don't allow a vote. So what's going on in appropriations?
We did vote on that.